am Dr. Laura Moreno, and in this video, I want to talk to you about concentration and memory problems and the medical causes that many people ignore every single day. Have you ever walked into a room and suddenly forgotten why you went there? Have you ever searched for your phone while it was already in your hand? Have you struggled to remember names, appointments, or simple tasks that used to feel automatic? Maybe you blame stress. Maybe you say you're just tired. Maybe you tell yourself it's normal aging. But what if your brain is trying to warn you about something deeper? Because here's the truth that most people don't hear often enough. Memory and concentration are not just mental skills. They are biological functions. Your brain is an organ, just like your heart, your kidneys, or your liver. And when something is wrong inside your body, your brain is often one of the first places where symptoms appear. Difficulty focusing is not always laziness. Forgetfulness is not always age. Mental fog is not always emotional. Sometimes it's medical. Sometimes it's chemical. Sometimes it's your body asking for help. Many of my patients come to me worried. They say, "Doctor, I feel distracted all the time. I can't concentrate like before. I read the same paragraph 3 times. I forget conversations. I feel like my brain is slower." And they're scared. They think something is seriously wrong with their mind. But what surprises them is this. Very often, the cause isn't psychological at all. It's physical, because your brain depends on oxygen, nutrients, hormones, blood flow, sleep, and metabolic balance. The moment one of these systems fails, even slightly, your thinking begins to suffer. Think of your brain like a high-performance engine. It requires premium fuel, steady energy, and constant maintenance. If you give it poor nutrition, bad sleep, low oxygen, or hormonal chaos, it won't perform properly. And the first signs are subtle. You lose focus more easily, you feel mentally tired, you forget small things, you struggle to find the right words, you feel slower, and most people ignore these signs for months or even years. They adapt, they normalize it, they say, "This is just how I am now." But that's rarely true. Your brain is designed to be sharp, alert, and efficient. So when it's not, we must ask why. One of the most common medical causes I see in my practice is sleep deprivation. And I'm not just talking about sleeping fewer hours. I'm talking about poor quality sleep. You can spend 8 hours in bed and still wake up exhausted. During deep sleep, your brain performs critical maintenance. It clears toxins, consolidates memories, repairs cells, and resets neurotransmitters. Without deep sleep, your brain becomes foggy the next day. Your reaction time slows down, your attention span shortens, your memory weakens. It's almost like being mildly intoxicated. Studies show that sleeping only 5 or 6 hours regularly can reduce cognitive performance as much as alcohol does. Imagine trying to work or study with your brain functioning at half capacity every day. And yet, millions of people live exactly like this, scrolling at night, watching screens, drinking caffeine late, waking up multiple times, ignoring sleep apnea. Then they wonder why they can't think clearly. But sleep is only the beginning. Another major cause is blood sugar imbalance. Your brain consumes a huge amount of glucose. In fact, it uses more energy than almost any other organ in your body. But it needs stable glucose levels, not spikes and crashes. When you eat excessive sugar or refined carbohydrates, your blood sugar rises quickly, then drops suddenly. And when it drops, your brain feels it immediately. You may feel dizzy, irritable, confused, slow, unable to focus. That afternoon brain fog many people experience after lunch isn't laziness. It's often a glucose crash. Over time, insulin resistance and prediabetes can quietly damage cognitive function. In fact, some researchers even call Alzheimer's disease type 3 diabetes because of how strongly blood sugar problems affect the brain. So when someone tells me they feel mentally tired all the time, I don't only ask about stress. I ask about breakfast. I ask about sugar. I ask about processed foods. Because what you eat literally becomes the fuel your brain uses to think. Then we have something that many people never suspect: dehydration. Even mild dehydration, just 1 or 2% fluid loss, can reduce attention, memory, and mental clarity. Your brain is mostly water. When you don't drink enough, blood flow decreases, oxygen delivery drops, cells don't communicate efficiently, and you feel it as fatigue and poor concentration. Sometimes the solution isn't complicated. Sometimes it's simply drinking more water consistently. But there are deeper medical causes too. Hormones play an enormous role in brain performance. For example, thyroid problems. An underactive thyroid slows down your entire metabolism, including your brain. Patients often describe it the same way. They say, "Doctor, I feel like I'm thinking through mud." They forget words. They lose motivation. They feel sleepy. They struggle to concentrate. And many assume it's depression or aging. But a simple blood test reveals the real issue: low thyroid hormone. And once treated, their mind becomes sharp again. It's incredible how quickly cognition improves when the body is balanced. Hormones like estrogen and testosterone also affect memory and focus. That's why many women notice brain fog during menopause. That's why some men with low testosterone feel mentally sluggish. These changes aren't imaginary, they're biological. Your brain chemistry depends on hormones. When hormones fluctuate, thinking changes too. And then there's something we rarely talk about enough: vitamin deficiencies. Your brain needs specific nutrients to function properly. Vitamin B12, for example, is essential for nerve health. Low B12 can cause memory loss, confusion, poor concentration, even mood changes. And it can happen slowly, quietly, especially in vegetarians, older adults, or people with digestive problems. Iron deficiency is another hidden cause. Without enough iron, your blood carries less oxygen. Less oxygen means less energy for your brain. You feel tired, unfocused, forgetful. Even vitamin D deficiency has been linked to cognitive decline. Yet millions of people walk around deficient without knowing. Sometimes the problem isn't your brain itself. It's simply that your brain isn't getting what it needs to function. And when you correct these deficiencies, clarity returns like someone turned the lights back on inside your head. Simple corrections that give your brain exactly what it has been asking for. And this is where I want you to slow down and really reflect for a moment, because many people treat their brain as if it were separate from the rest of the body. They say things like, "My memory is bad," or "My concentration is terrible," as if their mind were defective. But your brain is not failing randomly. It is responding to conditions. Just like your muscles get weak without movement, your brain gets weak without proper care. Cognitive health is physical health. There is no separation. Let me share something I see very often in my clinic. A patient comes in worried because they can't focus at work anymore. They feel distracted, forgetful, mentally slow. They think they're burned out or maybe developing something serious. So we run some basic tests: blood work, vitamin levels, thyroid function, blood sugar, iron, inflammatory markers. And surprisingly, many times the answer appears right there on paper: low B12, low iron, prediabetes, thyroid imbalance, vitamin D deficiency. Nothing dramatic, nothing catastrophic, just small imbalances that quietly sabotage brain performance every single day. And once we correct them, something amazing happens. Within weeks, they come back saying, "Doctor, I feel like myself again." That sentence is powerful because it reminds us that brain fog is not always permanent. Sometimes it's reversible, and that's incredibly hopeful. Now let's talk about inflammation, a word that sounds simple but has huge consequences inside your body. Inflammation is your immune system's response to stress or damage. In small amounts, it protects you. But when it becomes chronic, it starts harming healthy tissues, including your brain. Chronic low-grade inflammation can come from many sources: poor diet full of processed foods, too much sugar, smoking, lack of exercise, obesity, chronic infections, long-term stress. All of these create an inflammatory environment, And inflammation affects the brain in very subtle ways. It interferes with neurotransmitters like serotonin and dopamine. It disrupts communication between neurons. It reduces mental clarity. You may not feel sick, but you feel off, sluggish, unmotivated, foggy. Some researchers even describe this as brain on fire, not literally, of course, but chemically irritated. This is why anti-inflammatory habits often improve cognition. Eating whole foods, vegetables, healthy fats, omega-3s, regular exercise, proper sleep. These aren't just good for your heart, they directly protect your brain cells. And then there's movement. Many people underestimate how powerful exercise is for memory and focus. When you move your body, you increase blood flow to the brain. More oxygen, more nutrients, more energy. Exercise also stimulates something called BDNF, brain-derived neurotrophic factor. You can think of it as fertilizer for your brain. It helps neurons grow, connect, and survive. Without movement, your brain becomes stagnant. With movement, it becomes more flexible and resilient. Even something as simple as a 30-minute walk each day can significantly improve concentration and memory over time. You don't need extreme workouts. Consistency matters more than intensity. And yet, modern life keeps us sitting for hours and hours. Screens all day, cars, desks, couches. Our brains evolved with movement, but we've created stillness. And our cognition pays the price. Another medical issue we must not ignore is depression. Depression is not just sadness, it is a whole body condition. It changes brain chemistry, it alters sleep, it affects energy, it reduces motivation. And one of its most common symptoms is cognitive dysfunction. Many depressed patients say, I can't think, or my brain feels slow, or I can't concentrate on anything. This is sometimes called pseudodementia because it can look like memory loss. But the root cause is mood-related brain chemistry. When depression is treated, cognition often improves dramatically. So if you feel mental fog along with loss of interest, low energy, or persistent sadness, it's important not to ignore your emotional health. Your mind and brain are deeply connected. Treating one helps the other. And let's not forget anxiety. An anxious brain is not a focused brain. When you're worried all the time, your attention is constantly scanning for threats. What if something goes wrong? What did I forget? What's next? Your brain can't concentrate on the present moment because it's trapped in future fears. This constant hypervigilance drains cognitive resources. It's like having too many apps open on your phone at the same time. Everything slows down. Memory weakens. Focus disappears. Sometimes people think they have memory problems, but what they really have is an anxious brain that never rests long enough to store information properly. Because memory requires attention first. If you're not fully present, you can't remember later. Now, here's something else that surprises many people. Hearing and vision problems can also affect memory and concentration. Yes, something as simple as poor hearing. If your brain has to work extra hard just to understand sounds or words, it uses more energy for decoding and less energy for remembering. The same happens with vision strain. If you're constantly squinting or struggling to read clearly, your brain gets tired faster. Mental fatigue appears sooner. Concentration drops. Sometimes cognitive complaints improve simply by correcting hearing or vision. Glasses, hearing aids, better lighting. Small changes, big results. And this is why I always say, never assume your brain is the problem until you evaluate the whole body. Because the brain depends on everything else. It's not isolated. It's connected to every system you have. Your blood, your hormones, your lungs, your heart, your gut. Even your gut bacteria play a role. Yes, your digestive system influences your brain more than you might think. The gut produces many neurotransmitters, including serotonin. If your gut health is poor, your brain chemistry can suffer. Chronic digestive problems, poor diet, or imbalanced microbiota have been linked to mood changes and cognitive issues. So again, brain health is whole body health. Everything is connected. Nothing works alone. And when concentration and memory problems appear, they are often your body's first whisper. Not the final diagnosis, not the final diagnosis, but an early signal that something inside you needs attention. And this is exactly why ignoring these symptoms for months or years can be a mistake. Because the brain rarely fails suddenly. Most of the time, it declines gradually, quietly, so quietly that you normalize it. You start saying things like, I'm just getting older, or that's normal, everyone forgets things, or I'm just tired. But normal aging does not mean constant mental fog. Normal aging does not mean forgetting conversations every day. Normal aging does not mean losing focus to the point that it affects your work or your relationships. When changes interfere with daily life, your body is asking for help. Let's talk about another very important medical cause that many people overlook: dehydration. Yes, something as simple as not drinking enough water. Your brain is made of around 70% water. Even mild dehydration can reduce blood flow to the brain. It can lower oxygen delivery. It can increase fatigue. And one of the first symptoms is difficulty concentrating. Headaches, mental slowness, irritability, poor short-term memory. Some studies show that losing just 1 to 2% of your body's water can significantly affect cognitive performance. And yet, many people drink coffee all day, maybe soda, maybe alcohol, but very little water. They feel foggy and don't realize their brain is simply thirsty. Sometimes the solution is not complicated. Sometimes it's as basic as hydration. Then we have medications. This is extremely important. Many common medications can affect memory and concentration, not because they are dangerous, but because they influence brain chemistry. Antihistamines for allergies, sleep medications, anti-anxiety drugs, some antidepressants, blood pressure medications, painkillers, even some stomach medications. All of these can cause drowsiness, slower thinking, or memory issues in certain people. And sometimes the patient doesn't connect the dots. They start a new medication and weeks later they feel mentally slow, but they blame stress or age. If you notice cognitive changes after starting or increasing a medication, talk to your doctor. Never stop it on your own, but ask. Sometimes adjusting the dose or switching to another option solves the problem completely. Your brain should never feel constantly sedated. Now let's discuss something that many people fear, but few understand clearly: neurodegenerative diseases. Conditions like Alzheimer's disease or other types of dementia. It's natural to worry about them when memory problems appear. But here's something very important I want you to remember. Not all memory problems mean dementia. In fact, most don't. Dementia usually involves progressive decline that affects multiple areas of life, not just forgetting names occasionally. We're talking about getting lost in familiar places, forgetting how to perform routine tasks, repeating the same questions over and over, major personality or behavior changes, difficulty managing money or daily responsibilities. These are red flags that require immediate medical evaluation. But everyday forgetfulness, especially when linked to stress, lack of sleep, or nutritional issues, is much more common and often reversible. So instead of panicking, focus on assessment. Evaluation brings clarity. Fear without information only creates more stress, which actually worsens memory. And speaking of stress, we need to go deeper into how powerful it really is. Chronic stress literally changes the brain. When you're under constant pressure, your body produces cortisol. Cortisol is useful short term, but when it stays elevated for months or years, it becomes harmful. High cortisol can damage the hippocampus, which is the area of the brain responsible for memory formation. It interferes with learning. It makes concentration harder. It reduces mental flexibility. So, if you live in a constant state of urgency, deadlines, worries, multitasking, and emotional overload, your brain never gets a chance to recover. It's like trying to think clearly while an alarm is constantly ringing in the background. Eventually, exhaustion takes over. Mental burnout is real, And it's medical, not laziness, not weakness. It's physiology. Your brain needs rest, just like your muscles. You cannot expect peak cognitive performance without recovery time. This brings us to something modern life has stolen from many people: deep, restorative breaks. Moments without screens, without notifications, without noise, without constant input. Your brain needs silence sometimes because memory consolidation happens during rest. When you pause, your brain organizes information. It stores what matters, it clears what doesn't. If you never stop, nothing gets properly stored. Everything becomes chaos, and chaos feels like forgetfulness. Now, let me ask you something important. When was the last time you truly rested? Not scrolling, not watching something, not answering messages, but simply resting, because that kind of rest is medicine for your brain. Another condition we must mention is anemia. Low iron levels reduce oxygen delivery to tissues, including the brain. Less oxygen means less energy, less clarity. People with anemia often feel tired, dizzy, unfocused, and forgetful. And again, this can look like a cognitive problem when it's actually a blood problem. A simple blood test can reveal it. Treatment can dramatically improve symptoms. And yet, many people live for years, feeling mentally slow simply because no one checked their iron levels. This is why I always emphasize medical evaluation before assuming the worst, because sometimes the cause is surprisingly simple. Now let's talk about infections. Certain infections, especially chronic ones, can affect cognition. Urinary infections in older adults, for example, sometimes cause confusion or memory changes before any other symptoms appear. Viral infections, inflammatory conditions, even long recovery after illnesses. All of these can temporarily affect mental clarity. Your immune system consumes a lot of energy when fighting infection, and the brain may feel slower as a result. So, if your concentration problems started after an illness, it may just be your body recovering. Healing takes time. Be patient with yourself. Not every cognitive change is permanent. Sometimes it's just your brain asking for recovery. And then there is alcohol. This one is straightforward but often minimized. Regular alcohol consumption directly affects memory centers. It disrupts sleep. It interferes with neurotransmitters. It reduces attention. Even moderate daily drinking can slowly affect cognitive performance over time. Many people say it's just one or two drinks, but if it's every day, the brain never fully resets. Reducing alcohol intake often leads to noticeable improvement in mental clarity within weeks. Clearer mornings, better focus, stronger memory. Sometimes the brain simply needs less chemical interference. And finally, something I always remind my patients: cognitive health is not built in one day, it's built through daily habits. Small choices repeated consistently. Sleep, hydration, movement, nutrition, stress management, medical checkups. None of these sound dramatic, but together they determine how well your brain functions for decades. There is no miracle pill for memory, but there is a powerful foundation, and most people underestimate how much control they actually have over their cognitive future. Your brain is incredibly adaptable. It can heal, it can strengthen, it can create new connections, but only if you give it the right environment. And when concentration or memory problems appear, instead of feeling fear or frustration, try to see them as information that your body is offering you. Information that something needs attention, not punishment, not a failure, not a sign that you are losing your mind, just information. And when you start seeing your symptoms this way, everything changes. Because instead of fear, you choose curiosity. Instead of ignoring, you choose to listen. Instead of assuming the worst, you investigate calmly and logically. Concentration and memory are not mysterious gifts that randomly disappear. They are biological functions. They depend on sleep, oxygen, nutrients, hormones, blood flow, emotional balance, and neurological health. When one of these pieces is out of place, your thinking becomes cloudy. But when you restore balance, clarity often returns. That's the part many people forget. The brain is not fragile, it's resilient, it's adaptable, it's constantly changing, and in many cases, it can recover faster than you expect. I have seen patients who believed they were developing something irreversible, only to discover that they were simply exhausted, dehydrated, deficient in vitamins, overwhelmed by stress, or dealing with a treatable medical condition. After small corrections, they felt sharp again, present again, like themselves again, and that's what we want. Not perfection, not superhuman memory, just clarity, just focus, just the ability to think, remember, and live your daily life with confidence. So if you've noticed concentration problems, don't ignore them. But don't panic either. Observe, track your symptoms, ask yourself important questions. Are you sleeping well? Are you eating properly? Are you drinking enough water? Are you constantly stressed? Are you taking medications that might affect you? Have you checked your thyroid, your iron, your vitamins, your blood sugar? These simple steps can reveal answers that change everything, because taking care of your brain is not about complicated treatments. It's about consistent care, daily habits, medical awareness, listening to your body before small problems become big ones. Your brain works for you every second of your life. It deserves attention, it deserves protection, and most importantly, it deserves respect. When you treat your cognitive health as a priority, not an afterthought, you give yourself the best chance to stay sharp, independent, and mentally strong for many years to come. And remember this: forgetfulness is not always aging, lack of focus is not always laziness, and mental fog is not something you simply have to accept. Very often, it's your body quietly saying, "Please take care of me." And when you finally listen, everything begins to improve.